Often we hear RSV and we think that it's something that only kids get, but you're saying that it's something adults need to keep an eye out for as well. Why is that?
Definitely. So RSV stands for Respiratory Syncytial virus. It's a virus that affects the respiratory tract. So what we think about is our kind of nose, throat, lungs, the whole kind of area from like top to bottom, so to speak. So we usually think about it in kids, like you said, because most kids by age 2, almost all of them will have had RSV. Now the first time you get RSV, especially when you're really young, especially less than 6 months, it gets you really sick and can end up being in the hospital because you need support with your breathing and just kind of, not get any worse. With adults, typically they've gotten the virus when they were younger, so what that means is that they've made some immunity to it, and it can often just show up almost like a cold. And the populations that we worry about more are those that are more at risk. So that tends to be people who have they're already predisposed. They have like a lung disease, a heart disease, they have asthma, they're exposed to smoke, or they are smokers. These are people where the body's defenses are a little bit already weakened. So in that case, instead of getting your usual symptoms, which can include the usual cough, runny nose, nasal congestion, that infection can kind of go lower down into your lungs. When it goes there, that's when you start to have trouble breathing. You can have wheezing. You can have symptoms almost like asthma. And so that's when it can get a little tricky.
How do you know when to differentiate between a cold and RSV?
Yeah, so that's a great question. The truth is, a lot of it is sort of clinical suspicion. Now, there are tests that you can do, and most of them, there are a few different ways to do them. Usually you get a nasal swab, and either they check the DNA, and that can come back in a couple days and tell you, yeah, it's RSV. But the more important thing sometimes in medicine is sort of like, well, if you know it's this diagnosis, what are you going to do about it? So what makes it different? Why even test it? The truth is with RSV, there's not much more to do except the usual things like rest, hydration, and maybe there's some evidence about whether some kind of supplements might help. But you always want to make sure that that's what's going on and not something else.
Are there risks if it goes untreated?
Like most viruses, I'd say there aren't any major risks in the sense that you're gonna get worse or not get better. Of course, in some patients where they're already at risk, the risk of it being untreated, so to speak, is that they may need more advanced care, like going to the hospital. But there isn't really a medicine or a drug that would kind of prevent that in any case. So it's kind of a tough situation in that regard. Adults should know too that most parents have heard of RSV because their kids have had it, and what kids usually get is called bronchiolitis. That's the kind of diagnosis that happens, and then that can spread between like kids and parents. And so if a kid has RSV, a parent can definitely get it. And so the biggest thing with all these viruses is really good hand washing and prevention. That's probably the best thing you can do.
All right, we need to stay clean.
Yeah.
Stay healthy.
Definitely.
Dr. Zaki, thank you so much for your time.
Yeah, you're welcome.